So shoulder pain is a very common problem that we have as we get older. The rotator cuff specifically does not age well. It becomes less elastic, and because of the mobility of the shoulder joint, it tends to wear down quicker than other soft tissues that we have in our body. So after the age of 50 or 55, about 25% of us will have rotator cuff problems, and we don't even know about it. Typically, the rotator cuff fails in different phases. The first phase is that we have the rotator cuff becoming inflamed because of impingement between the bony structures of the shoulder. Then eventually you get partial tearing, and then that leads over the years to complete tearing. So if we can get the rotator cuff in the initial stages before it tears, then there's things that we can do non-operatively. Certainly a stretching program for the rotator cuff is very important. Strengthening and rehab programs are important in preserving the life of the rotator cuff. If we get them in the later phases, then we can use cortisone to help improve the pain, coupled with, again, a physical therapy and rehab program to add to the life of the rotator cuff. In the very final stages, if we find that the rotator cuff is torn and the person has failed all the non-operative modalities, then surgery is the final result. And these surgeries are done arthroscopically. 95% of the surgeries that I do on the shoulder for rotator cuff disease are done through the scope. We do it through 3 or 4 little tiny poke holes, and the telescope is used to fix the rotator cuff damage that there might be. So to summarize, the earlier we can get in the rotator cuff disease process, we can treat them non-operatively. The final phases, when a tear occurs, surgery may be the only option, and we treat these usually minimally invasive through the telescope through 3 or 4 tiny poke holes.